This is the human side of healthcare, where we explore all aspects of today's ever-changing healthcare environment. Brought to you by the Dallas-Fort Worth Hospital Council and featuring CEO Stephen Love with co-host Thomas Miller. Now, let's make healthcare human again.
And welcome to the human side of healthcare. We're delighted that you're with us today. And today we're going to talk about a topic that I think many of our listeners would like to learn more about. We are going to talk with Dr. Diana Kirwan. She's a geriatric medicine specialist. She practices at Texas Health Presbyterian Hospital in Dallas. Dr. Kerwin, welcome to the show.
Thank you so much. It's good to be here.
Well, I'm going to start right in, and I think it's important for our listeners to understand this as kind of a foundation for the discussion. Can you explain to our listeners the difference between Alzheimer's disease and dementia?
Yes, a common question from families. So just to give you some background, I've been diagnosing and taking care of patients that have been diagnosed with memory disorders for many years. And oftentimes the question comes up when someone notices memory loss or they've been given a diagnosis of memory loss of, is this dementia or is this Alzheimer's? And they are one and the same. So just to take a step back, dementia actually is a very broad term. It can mean anything that causes decline in a person's brain function as they get older, but it's not normal aging. It means something else has affected their brain function and caused it to not perform as well as it should as they get older. So it's not normal aging. Dementia, oftentimes people can detect even just in casual conversation. If you talk to your neighbor or somebody at church and you notice that they're repeating themselves or asking the same question over and over again, a lot of times you can get an idea that there might be something there. So it's usually pretty easy to detect. Alzheimer's is just one disease that can lead to dementia, but it's not the only one. There's many other diseases that actually can cause changes in brain function that are not Alzheimer's disease. But Alzheimer's disease is the most common one in the United States. It's the most common cause of memory loss, and as it progresses, dementia in the United States for people over the age of 65. So that's why oftentimes it's that question of, is it dementia and then is it Alzheimer's? But it could be dementia and it could be some other disease besides Alzheimer's. There's things called Lewy body disease, frontal lobe dementias that are not Alzheimer's. But Alzheimer's typically presents with memory loss that progresses to the point where the person has difficulty doing everyday tasks, like remembering to take their medications, remembering to go to their doctor's appointments, remembering that they just spoke with a family member on the phone. And so that's why it's the one that we think of the most with memory loss. We think of the most with aging, but like I said, it's not the only cause of dementia, but it is one of the most common causes. So when someone comes into my office with a memory concern, and I determine that it's more memory loss than what I would expect for just normal aging, Alzheimer's is the first diagnosis I think of, but as the doctor, I actually have to look at many different things to be sure that it is Alzheimer's and it's not one of the other causes of memory loss or dementia.
Dr. Kerwin, is Alzheimer's disease hereditary?
That is a question that comes up a lot as well. For everyone, I think as we get older, we want to keep all of our faculties. And so when we do see a loved one, a family member that we're related to, that's either diagnosed with memory loss, Alzheimer's, or dementia, we oftentimes the family member looks to themselves and says, well, is that something I'm going to inherit from my mom or my dad, just like I might inherit their high blood pressure or diabetes or hair color? And so the one thing about Alzheimer's disease is it is an aging-related disease, meaning it is more common as you get older. So actually all of us, as you get older, especially after age 65, we're all at increased risk of developing Alzheimer's as you get older. And you're not necessarily going to get it just because of your family history, but it could be because you're getting older and there's other factors. There is some hereditary aspects of Alzheimer's. If it is in your family, you might be at increased risk. There is one gene that we know of called the ApoE4 gene that people who carry that particular gene that they inherit from their parents, it increases the risk that you may get Alzheimer's as you get older, but it's not guaranteed. It's not like if you inherit that gene from your mom or your dad, you're definitely going to get Alzheimer's. It's just a risk factor, just like many other risk factors. It's one of many things that can increase your risk as you get older. But it doesn't necessarily mean that you're going to get it. There are people that have the ApoE4 gene and never get Alzheimer's for whatever reason, and there are people who don't have it and still get Alzheimer's. So it is something that we look at in research, that we often will test for. If someone is having memory loss and there is a family history, we might test for that. It's actually available on some 23andMe and other genetic tests that you can do at home, which I don't recommend because the genetic piece and inheritability of Alzheimer's is something that really has to be put in a conversation with your doctor of what does that risk really mean, because just having that ApoE4 gene doesn't mean you're definitely going to get it. So having a family history of it, it is something that you should be more aware of and really do more anything that you can to preserve your brain health and take care of your brain, but it doesn't mean you're necessarily definitely going to get it. So it is something that you talk about with your doctor, definitely have your doctor know about it and learn what you can about brain health and keeping your own brain healthy so that you can reduce your own individual risk, even if there's a family history of Alzheimer's.
Is Alzheimer's a normal part of getting older?
Yeah, this is something that led to the reason why many people sometimes aren't diagnosed with Alzheimer's, because sometimes we think that just as you get older, you're going to have some memory loss. It's nothing to worry about. But we do know that having a change in your memory that affects your daily abilities to do things for yourself, no matter what your age, 70, 80, 90, you should still have just normal aging brain capacity and brain abilities. You should be able to manage all of your daily tasks, take your medications, remember appointments. When you start to have difficulty doing those things and it impacts your daily life, that is memory loss that goes beyond normal aging, and that's the sign that it's something else is going on in the brain that needs to be evaluated. And so that's why when you do have concerns about memory, don't necessarily just chalk it off to I'm just getting older. There is some normal aging-related changes in our brain. We do sometimes have to give ourselves reminders. Sometimes we have to give ourselves hints or clues to remember people's names. That's normal memory changes of aging. But when it gets to the point where the person's really having difficulty getting through the day and managing through the day, and they used to be able to do that without any issue, it's a sign that this is something more, and this is something to talk about with your doctor. The one challenge is that the person that's usually experiencing the memory loss related to Alzheimer's disease is often unaware that the memory loss is occurring. And that's another sign that it's not just normal aging-related changes. Typically, when you forget something, if I forget where I placed my keys, I forget where I parked my car, I usually know that I forgot, and I can walk back through my steps and find my way. The person that's experiencing the memory loss actually is unaware that they're repeating questions or asking the same thing over and over again, or when they misplace their keys, instead of realizing, oh, I must have forgotten where I placed them, they think somebody stole them, or they think that they don't realize at all that they're forgetting, even though the people around them notice it. And that is also a sign that that's not a normal aging process and something to speak about with your doctor to have that looked at and evaluated.
Dr. Diana Kirwan from Texas Health Dallas about dementia and Alzheimer's. And when we come back, we pick up with the very important question. So you or a loved one have been diagnosed. Now what? That's next on the Human Side of Healthcare.
This is the Human Side of Healthcare on 1080 KRLD and the radio.com app, where we feature healthcare's hottest topics and what our North Texas area hospitals are doing to make healthcare human again.
Welcome back to the Human Side of Healthcare. We're talking with Dr. Diana Kirwan. She's geriatric medicine specialist at Texas Health Presbyterian Hospital in Dallas. So many families affected by dementia, including my own. My mother had this in the last 5 years of her life. So the question we faced, and many face in their journey, is, so now you or a loved one has been diagnosed with dementia. What next?
So the diagnosis of Alzheimer's, first, it is a very different disease now than it was years ago. There's many more things that we understand about Alzheimer's disease and about how we can treat it. So the first thing is once the diagnosis is made, is a discussion about, what might change, what to expect. Short-term memory loss doesn't mean that the person doesn't have any ability to do things. And it's really finding ways to give them as much as to really help them with their memory and brain function to keep them enjoying and doing what they like to. So the first part as a physician is medications. There are medications approved and available that doctors can write prescriptions for that can help the brain and the memory function in a better place. Those are medications like something called Aricept or donepezil. There's another medication called Namenda or memantine. Those would be discussed with your doctor. And then the other piece is to look at what about any other brain health, any other ways that you can make your brain more healthy that will give it a better level of functioning every day. And that's something we really underestimate. We don't realize that actually healthy diet and exercise can help your memory, even if you've been diagnosed with an early stage of Alzheimer's. A daily walk for 30 minutes or some other type of exercise, looking at a brain healthy diet, that can help your brain actually maintain its memory function even if there is an Alzheimer's diagnosis there. And the other piece is looking at any areas that the memory loss might get into a safety issue. So if you are having mild memory impairment or memory loss, taking medications on a daily basis actually could become a risk if you forget to take them or if you don't realize you took them already and you take them again. So with that, taking medications for anybody without any memory issues can be complicated if you're on more than 2 or 3 medications. So the other thing we start to look at is what are the simple tools you can put in place to help reduce the risk that the memory loss is going to become a medical issue for you. So using something as simple as a pill box to help remind you if you took your medications. You can look at today is Wednesday. I took my medications this morning. I don't need to take them again. That can be very helpful. Using reminders for yourself, relying on your family or your spouse to help you with some of the short-term memory issues can be very helpful. And just being able to open up that conversation so it's not something that the person lives with and doesn't feel like there's nothing they can do about it. The other thing that the people can do is research. There's lots of research into how do we prevent Alzheimer's, when someone has Alzheimer's, can we slow down the memory loss and progression through exercise, diet, blood pressure control, or there's clinical trials looking at new treatments to find ways to better treat Alzheimer's and other dementias.
You mentioned the treatments, you mentioned some of the trials that are underway. Are we getting any closer to a cure?
Well, that is the hopeful part of Alzheimer's and the good news. It does feel as though it's been moving slowly. There's been clinical trials and research being done around the world in Alzheimer's, looking at, why do some people get it and other people do not? What are the risk factors for it? Are there things that we can do to reduce the risk? And then are there treatments available that can actually stop Alzheimer's or the memory loss from occurring at all? So the good news is that from a medication standpoint, there has been really extensive developments made in that area in the last 10 years. And actually there's several medications that look very promising that actually directly address Alzheimer's. So they're not just treating the symptoms, which is what some people feel is the current medications that are available treat the symptoms. They can't really address the underlying occurrence in the brain, which is a protein buildup called amyloid and tau. There are medications that are being developed in research that look like they can actually either stop or remove the abnormal protein buildup that could then either lead to slowing the progression or stopping the progression of memory loss, or potentially stopping a person from developing any memory loss in the early stages of Alzheimer's. So that's been a very hopeful area. The other really hopeful area as we're waiting for those treatments to develop is our understanding of simple preventative measures that actually can improve or help to slow down the memory progression as well, which are things like that I mentioned earlier about exercise. We really underestimated the beneficial effect of exercise. We also have really good research now that tells us that a healthy diet can immediately improve your brain health, but also reduce your risk of developing Alzheimer's over the years. So there's definitely things that we talk about with our patients about exercise, diet. It's something called the MIND diet, M-I-N-D. That's very helpful to look up. It actually has really good data. And then there's other things that actually you can talk with your doctor about and that your doctor can work with you to help lower your risk of developing Alzheimer's. Things like blood pressure. We never knew that controlling blood pressure actually could help reduce the risk of developing Alzheimer's. We're also finding that controlling cholesterol and controlling your sugars if you're diabetic can help reduce your risk of developing Alzheimer's disease. So we're starting to find that there's many more things that we can do to maintain brain health and reduce the risk of Alzheimer's than we ever thought. So the research now is, and it's always been very hopeful, but I really feel that we're really on the verge of several really key areas of development in both the prevention and the treatment of Alzheimer's that should help to reduce anyone's fears or anxieties about the disease, because it is very different now than it was 5, 10, 15 years ago.
You've really given us some great information, and we want to thank you for participating. But as you close this segment, for our listeners, you've touched on treatment, slowing the process. You've discussed the risk. Do you have any final thoughts for our listeners on how they can reduce the risk of developing Alzheimer's?
And that's, I think, the piece that's key here, because I think there is a lot of fear that we have about, how do we keep our brain function and faculties as we get older? And the good news is that there's things that every individual actually could start doing today that will help improve their brain health and will start to reduce their risk of developing Alzheimer's in the years to come. So simply being, doing some of your homework. You can go online. The Alzheimer's Association and other community resources have information about how you can reduce your risk or prevent Alzheimer's and improve your brain health. And so sometimes it's just a matter of doing a little bit of research or talk to your doctor about it. Your doctor can help guide you into what would be a brain healthy exercise regimen that I could safely do? What would be a brain healthy diet that I could follow? And you do want to have it tailored to your other medical issues. If you have difficulty with exercise, say if you have trouble walking or something, there is still exercises that you could safely do. So taking control of those areas, starting the conversations, going to the resources in the community, and learning all you can is really the best way, and taking control to say, I will keep my brain at the best possible functioning for the rest of my life by doing these things every day. And the good news is that we have research to show that those things do really help. So I don't want it to be that there's nothing you can do. There's actually something that all of us could do right away today.
Dr. Kerwin, thank you so much. This is a subject that I think you have really helped our listeners understand better, and you've given us some explanations, I think, that will help our listeners really strive to reduce their risk of developing Alzheimer's. We can't thank you enough for being on the show.
My pleasure, and thank you so much for having this conversation, and I do hope the information is helpful to your audience. Thank you.
Thomas, what a great discussion. I learned more about Alzheimer's, learned more about things that we need to do, and I hope this benefits our listeners, not only for them personally, but for family members and friends.
My mom had it the last about 5 years of her life, and my brother and I walked down that path and learned a lot together as we started to learn about 7 stages of this disease and its progression and how it affected her. And yeah, it is touching for families to be dealing with. The thing that I'm encouraged is when she said there is so much more new information now that we understand that even 7 or 8 years ago when my mom passed, we didn't have. So it's an upward progression. And of course, as the baby boomers move on, a lot of research and focus and information on this topic.
Absolutely. And Thomas, you just brought up a point, talked about you and your brother, the caregivers that are involved with Alzheimer's patients. We could do a complete show just on that, and things they should do and things they shouldn't do.
It absolutely touches a lot of families here in North Texas.
This is a tough subject, but it's something we need to talk about, and that's why I love this show. The hospitals here really want to show the human side of healthcare, and today we've obviously done that.
We're going to do it again for the second half of the show, and we're going to talk about the other end of the age spectrum. Let's move from the elderly to the young and talk about sports injuries.
Yeah, pediatric orthopedics is so important, and we're going to be talking with one of the leaders in that, which is Scottish Rite for Children.
Dr. Henry Ellis, pediatric orthopedic surgeon from Scottish Rite for Children, talking about your kids and sports, how to keep them safe, and what to do if they have an accident. That's next on the Human Side of Healthcare.
The DFW Hospital Council, along with our over 90 member hospitals in North Texas, are proud to bring you the human side of healthcare with Council President and CEO Stephen Love and co-host Thomas Miller.
And welcome to the Human Side of Healthcare. We're delighted you've joined us today. We want to talk about sports back in action now. You know, as COVID-19 does continue, we're coexisting, and our kids need to get back into sports. But unfortunately, sometimes they get injured, and then there are ways we can prevent it. We're delighted. We've got Dr. Henry Ellis with us today. He's a pediatric orthopedic surgeon at Scottish Rite for Children. Dr. Ellis, welcome to the show.
Thank you. I appreciate you having me on today.
You know, I'm sure you see a lot of sports practice injuries, but this time of the year, we're in the fall, in your pediatric practice, what do you typically see, and why is it kind of different now?
Well, I think that's a great question. You know, with football in Texas, soccer in Texas, basketball is about to start up, you know, the common injuries that we see are anywhere from concussions to overuse injuries to a little bit more serious injuries like a tear of the ACL or the anterior cruciate ligament. We also can see some shoulder instability, shoulder dislocations in those that play contact sports. And then in your throwing athlete, we commonly will see injuries associated with overuse of the shoulder or the elbow in some of our pitchers and softball players. Now that's probably common because a lot of them have been working and training towards the start of their season over the summer with camps and two-a-days. And this year we really didn't have that. So the biggest dramatic change that we're seeing is in the overuse injury. The overuse of the growth plate that we call apophysitis, or I'm sure many have heard of Osgood-Schlatter. Inflammatory conditions where you can have a tendinitis or an equivalent form of inflammation that occurs. And generally, your overuse injuries, we're seeing a lot less of that, and we're seeing a little bit less of concussions just because we're just not seeing quite the training that we have before. I will tell you, though, we've been busy. Some of the acute injuries, like injuries to the knee, ligament injuries to the knee, kneecap dislocation, shoulder instability, you know, we're still seeing a pretty high rate of those. And, you know, I'm wondering if it's really due to a heavier period of inactivity to then going back and playing their sport 100% is causing some of these more acute injuries that we weren't expecting to see. I really thought COVID would actually decrease the rates of those, but we're just really not seeing that. Another big category that we're seeing a little bit in higher frequency is things like a stress fracture. When you go from a period of really significant inactivity to then really significant activity. For example, you know, someone who wasn't running a lot during the summer and then they start cross country and they're running 3 miles a day or 30 miles a week, we're starting to see a little bit higher incidence of a dramatic change in activity, which can cause things like stress fractures.
You know, you touched on this in your answer, but I'll see if you can expand a little bit. What concerns have you seen or do you have about COVID-19, the physical distancing restrictions, and how that's impacted and affected our young people?
Well, I don't want to discount just the overall, you know, the overall physical concerns of COVID-19 and the, you know, all the sequela of the infection itself. Now, assuming those concerns exist, and many people have decided a balance in their life about how much they are going to pursue sports or deal with the social distancing. But I'll tell you, my biggest concern with these young athletes is really two things. One of them is the mental health. These young athletes, they identify themselves as athletes. A young kid, 10, 11, 12-year-old, you know, they see themselves as soccer players. Oftentimes they see themselves professionally wanting to play sports because that's their identity. And when you take that away from them, sometimes they have to learn a little bit more about their identity earlier in life than they're used to having to do that. And I do think there's some mental health implications to some of these youth athletes that we really worry about. And we've been studying that as well. And we know that there's a fair amount of kids that are having some signs of depression and anxiety, particularly those that play high-level sport. Now, we did a survey of about 700 high-level athletes here at Scottish Rite, and what we found is those kids that play single sports, so sports specialization, seem to have higher rates of signs of depression and anxiety during COVID. And so I do think mental health is a concern that we're going to have to balance with the physical concerns of COVID-19. The second thing is the development of our athletes, or even kids in general. As an adult, we can, none of us want to take a year off of life or take 6 months of quarantining or not going to school or virtual everything. But kids are developing. I mean, their brains are developing, their bodies are developing, their personalities are developing. And when you have something like COVID-19 hit, I mean, it really may lose an important part of their natural, normal development. And so, the second concern I have other than mental health is the overall development of youth athletes. And so some way we're going to have to find a balance between the health and safety from a sociologic standpoint of COVID-19 to the health and safety of our kids and try to facilitate normal development as best we can.
Those are some excellent points, and especially the part about the anxiety and the depression. And it's going to be interesting as you continue those studies, some of the findings. We'll have to check back with you as you get a more comprehensive study. I'm going to pivot just a little bit and touch on prevention. Do you have advice to our listeners, especially parents that have children in sports, as to how we can prevent some of these injuries as children get back into sports?
Boy, yeah, I really think this is another really good topic of conversation, and I do think that there are several really key things to consider. Number one is kids should not have an on and off switch. We can't say that they're inactive and then all of a sudden they go back to their high level of sports. And so you really have to think about a slow and methodical return to the level of sports, no matter how high end or high level of competition that they're on. And so you really have to be mindful of their inactivity and gradually increase their activity over time. What's the right timeline? Well, it really depends on the athlete and the age, but generally speaking, a 6 to 8 week return to full activity is very reasonable. And if your kid is used to playing 3 or 4 or 5 sports, you may want to start off with 2 or 3 first and then gradually pick up sports and get them to build up to where they are again. The second thing regarding preventing injuries is sometimes we think that good condition and aerobic exercises is helpful in preventing injuries, and I may touch on that a little bit more, but I can't emphasize enough the importance of sleep and nutrition. To balance their energy that they expend during sports to the energy that they consume is really important. And so we have to be able to be mindful that our kids have been at home doing a lot of virtual, not at recess, not running around, and then all of a sudden they may be starting to do more and more sports, and we need to be sure that we are very mindful on their nutrition as well as their sleep quality. Sleep patterns are really important in these young kids. We actually found that during COVID, kids had better sleep. These young athletes, they improved their sleep per hour for about an hour a week, and they improved the quality of sleep. And so that's something for us to reflect and say there are some positives that we learned from COVID, is that maybe we string out our kids a little bit too much with school and athletics. And so as they get back, we just have to be mindful of some of these good things that we can learn from COVID in our kids. And interestingly enough, sleep and nutrition can be really important factors in preventing injuries.
That's great advice. Are there any specific injuries that you treat that you think could be more preventable than others?
Yeah, absolutely. The most common injury that we see in a young athlete across all sports are ankle injuries. So this can be anything from your common ankle sprain to an ankle fracture. And in my opinion, this is one of the more preventable injuries that we can really work on. Balance exercises can really be valuable in preventing ankle injury. You really learn how to recruit the right muscles, the right nerves to activate the ankle. And we use the term proprioception, which is your subconscious ability to really know how your ankle is working during an athletic event. I oftentimes will tell my patients to practice balancing when they're practicing shooting hoops in the backyard. They can do it with one foot. They can practice throwing a football with one foot. When they brush their teeth when they go to bed, they can do it with one foot. And when it's really easy to do, then they have to stand on a towel, create a little bit of an uneven surface. And you'll notice that at first, your ankle feels a little bit wobbly, like you're off balance. But over time, you'll really learn how to balance. And that's going to be a really important way to prevent ankle injuries. The second preventable injury, a little bit more of a serious injury, is the anterior cruciate ligament. I'm sure everyone's heard of the ACL tear. It's really a devastating injury to the knee that we see far too common. And before COVID, we used to say that this was an epidemic in our youth sports, is the ACL injury. Time and time again do we learn that this is also preventable. It's preventable with proper conditioning before the season. There have been numerous studies that have evaluated the exercise program before the soccer season, football season, basketball season, looking at hip and core stability exercises to try to prevent ACL and other knee injuries. And so to really be focused on the proper conditioning of the hip and the core can really affect preventing knee injuries, including ACL injuries. And there's a lot of resources available online to look at ACL prevention injuries. And I really would encourage a lot of the higher-end athletes, really when they start hitting the 12 to 13, 14-year-old age group, to really start considering putting some emphasis on their coaches and their coaches' team to look at injury prevention programs for their kids.
Texas Scottish Rite for Children is one of the leaders literally in the world in orthopedic medicine for children. You're listening to Dr. Henry Ellis, pediatric orthopedic surgeon at Scottish Rite for Children. A very interesting conversation about growth plates in teens when we come back on the human side of healthcare. Stay with us.
We're continuing our conversation on how you can empower yourself to have the best health possible in today's ever-changing healthcare environments. This is the human side of healthcare with DFW Hospital Council President and CEO Stephen Love and co-host Thomas Miller.
Welcome back. We're talking with Dr. Henry Ellis. He's pediatric orthopedic surgeon at Scottish Rite for Children about sports injuries with our kids. In the fall, it is a reality for many families. My son had an ACL tear when he was 14 in lacrosse practice. It was a 6-month journey just to get answers because his growth plates were still forming. So we're going to talk about that. But first, let's ask that very important question that we faced. Where can you get resources of good, accurate information?
Yeah, I think there's a couple layers to the answer to answer this question. And I would first just recommend that there are numerous resources when you start thinking about your kids and sports during the COVID pandemic. The American Academy of Pediatrics, the National Athletic Training Association, the American Medical Sports Medicine Association, as well as the CDC, all have toolkits to help guide you on safe return to sports and whether it's right for you and your family. Now, a lot of that needs to be determined within your own household. I think if you have immune-compromised patients, family members, elderly within your household, it may be something in which you weigh the risks and benefits towards athletic involvement. And I think that decision needs to be individualized per family. Resources are really sports-specific. And so we are involved with the Dallas Mavericks Hoops program. And there is a junior MBA program that really helps facilitate and teach families how to safely play basketball and what are some good, safe tips to do so. I know that the Mavericks Hoops program here in town has been working with Scottish Rite, and I've been personally working with them, and they have really been welcoming and collaborative for us to be sure to give the message out to the youth basketball players. But there is a website, both with the Dallas Mavericks Hoops program, that can help lead families to good basketball tips. The USA Little League Baseball is also a really good reference for families in terms of pitchers when it comes down to when they can throw a curveball, a fastball, how many innings can they pitch, how many pitches can they can they throw? And all of that is really well documented in USA Baseball and on their website as well. Football is tough. It's probably the hardest answer that we have to answer right now as a provider. And no question is harder to answer than, is my kid going to play football? With everything we know with concussions, am I going to allow it? The answer is, if he's interested, I probably will. I don't believe from a football standpoint, the thing we have to probably worry the most about is concussions. And the important part about concussions is we need to be mindful on recurrent concussions, number one, and proper concussion protocol following the concussion. In my family, I have a 2 concussion rule. If my kids have more than 2 concussions, we're going to try to look for another sport.
What are some of the new frontiers that you're learning about now?
Boy, that's a great question, and it's really our favorite subject here. We really have 2 strategies, 2 really important strategies that we're constantly learning about. Number one is returning to play. When is the right time to return to full activity? When is an athlete ready? This is mostly after an injury, because once you have one injury, the risk that you have a second injury is pretty high, whether that's an ankle sprain, an ACL injury, shoulder dislocation. And so a return to play criteria we've been studying now for about 4 or 5 years, and we continue to want to know what are the factors important that an athlete has to achieve before they get on the field. I've been collaborating with our therapy and our therapist team here to test these kids at particular intervals, and we find that oftentimes we think that from their injury they're healed, but they may not be fully rehabbed from the injury itself. And so learning about return to play guidelines is something that we have an active interest in. The second area is really injury prevention. And we have a movement science lab. And, for those that are aware of what movement science is, for those that are not, it's very much like the avatars you see on TV, where we put all these balls on athletes and then we have high-speed motion cameras, and we're trying to look at what their mechanics are. And so we've been bringing in teams, youth teams, soccer teams, volleyball teams, and we're actually looking at their mechanics before the season. And as we follow them during their season, we want to know what kind of injuries they have and how they respond to those injuries. Our hopes are that we'll continue to learn about different types of athletes, different sports, so that we can understand what biomechanical differences we note in kids that have injuries to those that do not. So we're looking at ways in which they jump, they land, they run, they cut and pivot, they kick a ball, they do a layup. We're pulling all of those kids. We're doing healthy kids in our labs, hoping that they don't get injuries. But when they do, we can go back and look at our data and say, well, hey, look at here. They land on their foot with a little bit less hip and knee flexion than perhaps these other athletes that don't. And so we're trying to learn as much as we can to try to prevent these youth kids in a variety of sports and at different ages.
I wanted to ask you about growth plates. You mentioned that early on. Can you explain for parents so they understand what the factors of still closing growth plates imply for their kids?
Yeah, that's really a great question. What a growth plate is an area on the bone where cells reproduce and they actually longitudinally grow. So a bone, if you think of the big bone in your leg and your thigh, it doesn't really grow from the center, and those bone cells are not actually what's growing. You have a growth plate below and a growth plate above in most bones, and they grow from the ends of the bones. And so the cells from the growth plate actually reproduce, and they're actually cartilage cells. So those cartilage cells are reproducing, and they are growing the bone at locations and not throughout the entire bone. So that's really important because bone is brittle. Generally speaking, if you think of a bone, it's really, from a tissue standpoint, it's a very brittle tissue. But growth plates are very soft. And that's why injuries to the growth plate frequently will precede a tendon, a ligament, or a bone, because a growth plate is made up of cartilage cells and it's much softer. That's why sometimes we say, kids are a little bit more like Gumby. Their bones are a little bit more flexible and less brittle. A lot of that has to do with their growth plates. Now, an injury to the growth plate, most of the time, will not have any permanent damage. But an injury to the growth plate may, and oftentimes rarely, can produce a problem with future growth in that leg.
So then for the young athlete who gets injured in that developmental phase, what does that mean as far as the healing goes?
Well, if you have a young athlete and they have an injury, the first thing to probably really identify is whether there's a growth plate injury there or not, because you want it to be treated and you want it to be treated well. If you have a knee injury, it may be a ligament, it may be cartilage, it may be a meniscus, but if it's the growth plate, we want to protect it. And we want to protect it because you still have a lot of growing left to do. I would say your body's very resilient. And again, most growth plates will heal well without a long-term problem. But if it's underappreciated or not identified or not really protected well, sometimes an injury to the growth plate that doesn't heal well will allow for that leg to have future growth that may produce a little bit of a crooked or shortened leg. Having a growth plate injury is not the end of the world, though. It may sound really bad, but knowledge of a growth plate injury and to treat it and to manage it, we have lots of tricks. So it's not the end of the world. It's not like that leg will permanently be short. Every growth plate has a different rate of growth. So sometimes we may be talking about a half a centimeter. Sometimes we're talking about 6 or 7 centimeters. It's very different depending on the location, the age of the patient. But again, growth plate injury sounds scary. We do see it. We want to protect it. But in worst case scenario, we oftentimes have lots of tricks up our sleeves that we could do to try to manipulate the growth plate to fix a shortened leg or to fix a little bit of a crooked leg. Sometimes we can do it really minimally invasive too. So it really is something to be mindful for. We want to watch for it. It is rare. But when we see it, we usually can find ways to try to fix it as well.
Dr. Henry Ellis, thank you for joining us from Scottish Rite for Children with some of the most updated information on how to take care of our kids. If you missed any of this, our podcast is on all the major podcast players, either Dr. Ellis's segment or Dementia. Just search the human side of healthcare.
In the meantime, please be safe, wear your mask, wash your hands, physical distance, okay? See you next week.